What do you tell a patient to do if they've got a tension, non-migraine, like low-grade, steady pain headache? How do they treat that?
Well, it becomes really important because I'm going to kind of jump to a term that we use, and that is medication overuse headache.
Overuse headache.
Overuse headache. And that is that headache people, it seems, are just kind of put together different in that the chemicals that are released that seem to be related to the headache, when they are given certain medications, those medicines will decrease the level of those chemicals, but when the medicine wears out of the system, the chemical may come back in a higher level. More medicine is taken. So as a result of that, what we know is that with tension headaches, aspirin, Tylenol, acetaminophen, these sorts of medicines can be very effective. But there's plenty of data that if you're taking those general analgesics more than 15 days a month, you can end up with what's known as medication overuse headache that then takes on a lot of features of a migraine headache. And all of a sudden, the medicine you're taking to get rid of your headache, you find your headache is more and more frequent, and it is causing it. And it's a real problem.
So what do you do for that? Do you have to use some other modalities like heat and cold and activity and exercise?
Absolutely. Trying to have your life organized, eating right, sleeping right, exercise, just looking after your general health is very, very important. And really trying to keep the medications to a minimum and not relying on them.
Is the combination of the interaction between the doctor and the patient, I'm going to go to the drugstore and get some Tylenol, the doctor saying, you know, well, mild medicines will work. Do both the doctor and the patient recognize that overuse can be the big problem?
I hope they do. But again, when we see what we call chronic headache, which is basically more than 15 days a month of headache, or there's an operational definition of at least 150 days or so of headaches per year, that fits the category of chronic headache. And if you look at that group is made up of a certain number who have had what's known as transformed migraine, where migraines have become more frequent, but a large group of that is chronic tension type headache, of which a large category is the overuse medication group.